Welcome to Inside WRHN, a video series that gives you an inside look at the amazing care that's being delivered at the Waterloo Regional Health Network. I'm your host, Doug Earle, and I'm the CEO of WRHN Foundation. And today I'm joined by Dr. Lori-Ann Williams, the head of our Department of Psychiatry and Medical Director and Department Chief. Welcome.
Thank you for having me.
Yeah, very much. Pleasure. We're going to talk about one of the most urgent issues facing our community, and that is mental wellness, mental health. So I look forward to our conversation and the amazing work. So why don't we start? So can you tell us a little bit about yourself and what drew you to mental health?
You know, interestingly, my parents found when I was in grade 6, they found a notebook that had psychiatrist written as my career, what I wanted to be. It was spelled wrong, but that's what they found that I wanted to be.
Yes.
But I didn't think about that at all and kind of going through school. And then it was actually when I was in medical school, and I went to a talk, and it was given by a fellow who had PTSD and depression. And he was talking to the medical students about his experience, about mental wellness. And what really struck me, he made a comment, and he actually got very tearful, and he talked about his fear. And he said his biggest fear was that he has been faking childhood for his children, like faking their childhood, that he's been pretending he's happy. Everything was kind of a fake to put on for them. And that really resonated with me. It really spoke to me about really the importance of mental health, and really with like physical health. I get it. It's really important. But without mental health, the quality of life goes down so much, and he wasn't able to enjoy his children's childhood, which just really spoke to me, and it made me want to kind of explore the field a little bit more.
And what is your role at WRHN?
So I'm Chief of Psychiatry and Medical Director of Psychiatry. Mm-hmm. So Chief of Psychiatry kind of works mostly with the physicians. So I would be responsible for sort of performance and reviewing patient feedback and family feedback, recruitment. Those are the big things that the chief does. The medical director role is a little bit different. I work alongside our program director, and we're really responsible for all of the programming within the Department of Psychiatry. So we're looking at optimization of services, expansion of services, resource allocation, really to try to be able to meet community needs. So
what are the services and programs that we provide?
At WRHN, I would say we probably have 3 main areas that we focus on. So one would be our child and adolescent programming, and then we have our acute adult programming, and then we have more our specialized mental health programming that we offer as well. So our child and adolescent is for those under 18. We have an inpatient unit and an outpatient program. And our acute adult, it's actually similar across all the programs. So for acute adult, again, we have acute inpatient beds, and we have adult programming as well. And then for our specialized mental health program, that's really focusing on patients who need a little bit longer in order to recover, focuses on a lot of severe and persistent mental illness. So again, we offer inpatient programming for those patients as well as outpatient programs as well.
So the program sees, I understand, about 3,400 patients annually on the inpatient side and about 8,000 on the outpatient side. Is this growing? Is it the need increasing? Have you found over the years?
So I think it fluctuates a little bit. The new hospital build, everything is projected to start to increase. Like there's new bed allocation across the board for all the programming. It's interesting as to why that's happening. I think reflecting on it, part of it is really the complexity of patients. So overall, I think we're seeing a lot more complexity for probably multiple different reasons. I think just mental illness itself, I think financial, social issues, family dynamics. There's just so many things that go into what we're seeing now, physical issues as well, which is impacting mental health. But what happens when you have a lot of complexity is it's really hard to have a lot of flow in the system. People are getting the services they need, but they're not leaving the services very quickly because they're requiring that acute level for a lot longer. So it's getting a lot harder for people to access care. The other reason I'd like to think that it's going up and that we're needing more services, I actually am hoping it's because the stigma is starting to reduce. I think as people are starting to have maybe a little bit, maybe while there's a little bit less stigma around mental health, I'm hoping that means people are also seeking the help that they need more quickly.
So just picking up on stigma, many people are more open to talking about mental health. And I worked at the Centre of Mental Health and Addictions in Toronto, and Mike Wilson used to tell the story that about his son, of course, and who had a death by suicide, and he would stand up alone, and people would really admire him for sharing that personal story because it wasn't usual. It wasn't something that happened. Is that changing? Do you see people becoming more open and talking about this stigma and about mental health and mental wellness, mental illness?
I think it's changing. I think we could do better. I think that's such a great example that you give. I think it makes such a difference when somebody prominent talks about their experience. It really makes a difference for other people in terms of sort of normalizing things, seeking help. I think there's so much benefit from that. Like when you really think with mental health, it really is probably the most debilitating illness that there is, the highest cause of disability worldwide. You know, I found one stat recently that said by the time people are 40 in Canada, 1 in 2 people are going to have either experienced mental illness or be experiencing mental illness at that time. That's huge. That's a huge amount of people that are experiencing mental illness. So I think that conversation has to keep going. And by people sharing those experiences, I think it does make a big difference to hopefully reduce that stigma and normalize things.
One area that we're hearing a lot about is child and youth mental illness. And I'm wondering, what is the demand for those services in our community?
High.
Yes.
It's very high. It's tough. So unfortunately, overall, I think we really don't have the resources to meet the demand. We do our best for sure, and we try to triage what we can, but there's a huge demand that for children that need mental health services. So both acutely and inpatient level, outpatient level as well. We're really finding even, the children under 12, that's a big focus right now within our program for the inpatient unit is how do we improve the experience for children under 12 that are admitted to hospital? I guess just sort of reflecting and thinking about it, like a child under 12 who's on a unit in the hospital, like in a totally different environment, like there's a lot of programming that has to happen in order to really serve that population the best that we can in order to assess, in order to treat. So there's a big focus right now trying to do an improvement with that population as well.
So can you tell me a little bit about the CAPE program, and why don't we start with what does the acronym stand for?
So that's the Child and Adolescent Inpatient Unit. So our CAPE program is a regional program. We are the inpatient unit for a number of different regions, including Guelph and Cambridge and some of the little surrounding areas around us. We have a pretty big unit comparatively. So we have 21 inpatient beds. So so if people put that into comparison, like that's similar, like Ottawa size. Like it's a pretty big program. We have some unique features. We can actually work with a lot of patients who require intensive care as well, which is really unique actually regionally as well. Some of the other bigger academic programs don't even have that ability, which we have. Patients are triaged usually through the emergency department. Sometimes patients can be directly admitted. All are assigned a psychiatrist and they have a team, and it's a really, really well-resourced team. They have child and youth workers, and they have nursing staff, and they have psychologists, and they have allied health staff, recreational therapists, music therapists. Like we have a really, really good team that helps support things. Keeping in mind, not all of that's funded. That's where it gets, I think we're really lucky that we're offering this much to patients who are admitted. But they even have a school program as well. So they continue school for patients who are admitted at that time too. And they treat a wide variety of, so we would see patients for like really very similar things that we would see in the adult population as well. So we can see patients in acute crisis. We can see patients who have depression or anxiety or family dynamic problems. We see patients who have developmental disabilities. It really goes like the whole spectrum, including psychotic disorders.
So, and we also have some unique programs like Propel.
Yeah, so Propel is a really, really unique one. So that doesn't just apply to our CAPE unit. So to complement our CAPE unit, we actually have our KUP program. So that's our child and adolescent outpatient program. So the Propel program, I think, so I've done a lot of recruiting. So when child psychiatrists do not grow on trees. And I've talked to a lot of child psychiatrists across Canada, even looking at the States to try to recruit to our program. And when I talk about programs that we have to offer, Propel is always one that people are super intrigued by. So the whole purpose of Propel is that often when people have mental health issues or for family access reasons, a lot of times people drop those things that bring them joy, meaning, pleasure, value, confidence. Those things just don't happen. And those are hugely important, especially in the developmental years. So that program is offered to our patients who are part of our program, really to help support them in their recovery journey, really to help bring back the sort of the humaneness of mental health and treatment and of life, and to try to bring back some of those experiences that are so important for development.
And can you share just how important the role of our donors are and their philanthropy to support your programs?
Oh my goodness. I think most of the things that I just mentioned wouldn't happen without the donors. So the Propel program completely wouldn't happen without donors. We have so many things, music therapy. We offer so many things within our program, even just the unit. So, I have to say, I don't actually know how old our building is, but it looks old, and we get a lot of comments that we do not have.
A part of your program is in 40 Green, and that's 100 years old.
Oh, it's pretty old.
It was opened in 1922.
Okay, so it's pretty old. We get lots of comments about the way our environment appears and how much the environment really impacts somebody's journey to wellness and their experience when they're admitted to hospital. Mm-hmm. A lot of our initiatives to improve that, from things from furniture to painting, to some of the programming that happens on the unit as well. A good chunk of it is because of our donors. It's a hugely important part of what we do.
So we have a big event coming up at the end of the month in support of mental health, Stronger Together. Mm-hmm. Can you tell us a little bit about the event and what you're looking forward to?
Yeah, so it's incredible, really. So this is the third year that it's running. It's a community-driven initiative, really to highlight and for the community to come together to support mental health. It is an incredible opportunity where people come to hear about mental health, support mental health, again, raise money for mental health, focusing on youth mental health. It's really been a tremendous experience to meet people, to hear their stories, really to see the commitment of people to mental health as well has just been really rewarding. It's really touching. We get very used to in the hospital. So I'm a physician primarily. I work daily on an inpatient unit. We get very used to sort of what we see in our very small lens. But when you see the community behind everything, it really makes a difference in how meaningful it is, about how much people care about the work that we're doing. And they really want our community to be offering the best services we can for our communities.
Of course, headliner for the event is Stephen Page, and his sharing his mental wellness journey and how it has influenced songs that he wrote and sang and performed. So it'll be a very intimate evening for people that want to participate. I'm very much looking forward to seeing it. So let's you sort of at the tail end there started talking about the future. Where do you see the services increasing, improving, Ren?
Yeah, it's a good question too. There's always things that we can improve on. I find it really interesting. I think there's a lot of focus now on trying to move services out of the hospital, trying to see what we can do to reduce hospital admissions, to bring clinics into the community, to improve accessibility. I see a lot of change happening with that, to really try to make care more personalized, more unique, more patient and family centered, but again, recognizing the individual complexities. So trying to really be much more responsive to that, again, in an environment where patients and families are most comfortable.
Great. And do you see innovations coming in the way we treat mental health?
It's slow.
Yes.
So I would say in mental health, it is slow. I think there are very unique medications, little tweaks on medications that make a big difference for patients' lives, for how they tolerate medications. I think it's fantastic that new things are always being introduced. There's neuromodulation techniques that are being offered where you're really looking at brain activity in order to try to improve treatment-resistant symptoms. I think, we see different things. I mean, there's always the controversial and exciting world of psychedelics that comes up as well. I think I don't think we're, it's coming up. It's not necessarily where we're using it clinically within the hospital, but it would be really exciting to see what we're offering. A lot of focus I hear right now is a lot on treatment resistant. We see a lot of patients who go through different treatments with their family doctors, different initial treatments with their psychiatrist, and they're still not achieving the quality of life that they really want to be achieving. So a lot of focus on improving those treatment-resistant cases to really bring back quality of life to people.
Tremendous. And I'm wondering, obviously, sometimes patients' stories really tell the story of what you're doing. Would you be able to share a story of keeping confidence, obviously, but just around some of the experiences and how the programs have changed their life?
I don't think there's one specific patient. I think it's actually quite similar amongst a lot of patients that we treat. I still think when patients come to hospital, they're vulnerable. They're usually in a crisis situation. They need help. It is amazing to see the turnaround that happens by the time patients leave hospital. And you really see that patients are able to return to things that bring them meaning. And that's really different for everyone. So I think what I think is the most the most important is actually recognizing what is the most important for each individual patient, because that's going to differ. So for some patients, it is returning to school. For some patients, it's going to be returning to work or having a better relationship with family. For some patients, it's returning to reading. It can be something simple like that. And when you actually help patients return to reading or something that brings them joy that they weren't able to do, I think it's really meaningful to be able to create that for patients.
Tremendous. And is there any messages that you would like to share with our donors and supporters of WRHN Foundation, and especially for those who support our mental health programs?
I think the first would be thank you. I mean, it's huge. I really, genuinely, I think personally and from the whole program, we truly appreciate everyone's interest in mental health, everyone's support of mental health. Really, we couldn't do it without the donors. I don't know if people actually appreciate how significant it is and how much the hospital relies on the foundation and our donors to be able to offer what we offer. So thank you would be the biggest thing that I would offer to people.
Well, thank you for joining us today. And this is Dr. Lori Ann Williams, who is our Chief of Psychiatry and our medical department lead for our mental wellness programs. And thank you for sharing your insights and what the future holds for WRHN and our mental health.
My pleasure. Thank you for having me.
Thank you for joining us. Of course, you can find out more at wrhnfoundation.ca. So that's WRHNF.ca. And please join us and follow along. Sign up for a newsletter to keep in touch with our developments in our mental health program and other programs at WRHN.